One of the things that was a deciding factor for me whenever I decided to become a nurse practitioner was I was so limited by the impact I could have on a patient at bedside. To be able to have a deeper role in a patient's life was one of the major factors for me, and COVID does not change that. It does not change the impact that you get to have on a patient's life. If anything, it's proven that nurses are willing to take a stand and to make even more of an impact on these patients' lives. I'm Josh Moore, and I recently graduated from UVA's Acute Care Pediatric Nurse Practitioner program. I'm originally from Southwest Virginia, a little town called Richlands, Virginia, and I've been in Charlottesville since I was 18. From my first day at UVA, I knew that this was the place to be. The community around this university is just so friendly, and to me that creates an environment where you can thrive because you're being pushed, but you're being supported, which is a dynamic duo, really. The more you're in clinical practice, the more you understand what should happen. As a nurse practitioner, you really understand why that should happen and what the why is behind your bedside practice. As an acute care pediatric nurse practitioner, you have to learn a different set of skills because you will be in a different role. We are trained to put in central lines, how to do arterial lines, how to perform lumbar punctures, how to intubate patients, and how to manage their sedation from that standpoint. And so it really is a completely different skill set that you really have to be in a lab and practice on in order to understand. The in-person classes are so nice and they're so intimate, and it's something that we all love about the School of Nursing. I'll also say that our professors took COVID very seriously, switched to online very quickly, and they made the absolute best of this. If you're working full-time or even part-time, going to school, it's not easy, and I don't think that anyone who would be entering into this program would expect it to be. But you become best friends with your classmates because you spend a lot of time with them, you are struggling together, but you're also achieving together. There's no way that I would have applied anywhere else for grad school.